Hey everyone, Dr. Ellie here today with her podcast, I Heal Kids. And if you don't know me, I have a pediatric practice in Asheville, North Carolina called Middle Path Integrative Pediatrics, and I am a holistic pediatrician. So if you need any help with holistic pediatrics for kiddos 0 to 21, definitely reach out to me. I also do functional medicine for kids and adults ages 2 to 102. So if you need help with that or you're not sure what functional medicine is, check out my other videos that will link in the show notes. Today we're talking about all things poop. So we're on the third episode of my 4-part mini series all about poop. We've talked about what's normal, we've talked about constipation, and now we're talking about when poop will not stop, aka diarrhea. So we'll link those first two. If you haven't seen those, go back and listen to those as well. So you know what's normal, first of all, because one of the main questions I get all the time is like, how do I even know if my baby has diarrhea, which is like obviously hard to tell. So if you aren't sure, go back into listen to what's normal and all of that. Okay, so diarrhea. We've all had it. Unfortunately, and it is not fun and it can be alarming, especially in babies. But today we're going to talk about like the different causes and how to treat it and what to do about it and all of that. So I just want to make a quick distinction between acute and chronic diarrhea. These are two things that are different medically. And all it means, it's just like a fancy way of saying, like, acute is just a fancy way of saying it's something that it just came on suddenly and it's not going to last very long and then it's going to go away quickly. And then chronic is something that's lasting for like a really long time, like let's say months, for example. That would be like chronic diarrhea. Okay. And those two things are a little bit different in how I think about that as a pediatrician. So let's start with like, what are the causes of diarrhea? So the absolute 100% most common thing that I see every single day of my life is viral diarrhea. And so this is something that kids get all the time, whether they're in daycare, whether they're in preschool, whether they're in school, or they're just out at the park. It's super easy to pick up a viral diarrhea. And there's a lot of things that can cause it. Rotavirus is one. Some of y'all might know about that because that's a vaccine that some of y'all are offered around 2 months old. Norovirus are frequent culprits. You always hear about that on like cruise ships. I don't know if cruise ships are getting a bad rap or like they need to do more cleaning, but I always feel like I hear about it on cruise ships. And these are the types of things that lead to what we call stomach flu. So a lot of times we say stomach flu. We're not really meaning like influenza, like, like the flu shot and all of that. We're talking about diarrhea and sometimes vomiting as well. And that's gastroenteritis. That's the medical name for it, is gastroenteritis. And then sometimes we call it stomach flu just when we're like talking to our friends or whatever. Okay. So if it's not viral, what else could it be? Well, it could be a bacteria. So things like salmonella, which would be like from your undercooked chicken, or like weirdly also turtles. So if you have like a pet turtle at home and your kiddo is having like weird diarrhea, you might want to mention that to your pediatrician because that can be a cause. Bacteria, E. coli, those are all bacteria that can cause diarrhea. And sometimes you can get this from like food poisoning too. So there's other kinds of bacteria that create toxins, and that's what gives us like food poisoning. Parasites. All right. I know y'all want to hear about parasites because this is something that comes up all the time. Is it a parasite? Oftentimes it's really not, but there are times that it can be, especially if like you've traveled or you've gone camping or you've had water that was kind of like maybe a little sketchy, that wasn't treated well or something like that. That can cause diarrhea. Like Giardia is like a parasite that commonly happens. And then like a more like rare cause of diarrhea, and this I would put in the chronic category more than the acute category, like we were talking about before with bacteria and viruses, would be like a food allergy or intolerance. So this is like being allergic to, like me, I'm allergic to wheat. So I have celiac disease. So if I have a boatload of gluten, which is what's in wheat that, is the problem for people that have celiac, then I can get a really bad upset stomach. I can get diarrhea. If I do it for too long, I'm going to get anemic. Like I can get all these major health problems. This is less common, especially in kiddos that are just having like short-term diarrhea, like maybe a week or two. But if it's something that's going on for months and months and months, you might think about, like your baby's not absorbing the food well, or maybe they're reacting to like soy or milk or, other foods, or they're having like lactose intolerance, which by the way is super uncommon in babies to have lactose intolerance. And I think I did a whole series about that too, like intolerances versus allergies. If I did, I'll link it. If I didn't, I'll make it because I can't quite remember right now, but I have like a vague memory of talking about that. Okay. Medications. So a lot of us know about this because we've taken an antibiotic and then we've gotten diarrhea. And a lot of antibiotics can really mess up the gut microbiome and throw things off. And then we get loose poop. We're not feeling so good. And there may be times that like we need to take those antibiotics, but we can clean it up on the back end with doing some support that I'm going to talk about a little bit later. Now, on the severe side with antibiotics, if you're doing like a boatload of antibiotics or like super strong antibiotics, you can get something called C. diff, which is like a gnarly bacterial infection, and that can cause like blood in the stool. Now, some people just like walk around carrying that and that doesn't cause any problems, but a lot of people who take a lot of antibiotics and get bloody diarrhea do end up having that. So if you're having that situation, you definitely need to go and get checked and figure out, do you have this gnarly bacteria that needs to get treated? Medical conditions, I touched on that earlier when I was talking about celiac disease. Celiac is an autoimmune disease, actually. A lot of people just think of it as like a food allergy because it's easy to talk about it like that. But your body is basically mounting an immune response to gluten or wheat. And what that does is instead of the normal thing where you eat wheat and you digest it and you make energy and blah, 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 your body gets this immune response to the wheat, instantaneously starts to attack its own body. So it actually has an immune response to its intestines. And so, if I eat wheat, my body starts trying to kill off these villi, these like finger like projections in my intestine. And then I can't absorb any food. And then I get diarrhea and other things too. Joint pain, I'll get anxiety, I'll get, what else? Long-term anemia, which I had when I was first diagnosed, all of that. Irritable bowel disease, that can happen too. And then inflammatory bowel disease, which those, you guys, are two different things. But if your kiddo is having like long-term diarrhea, like maybe they're not gaining weight well, they're anemic, they have blood in the poop, anything like that, you're going to want to talk to your pediatrician about inflammatory bowel, which is like Crohn's disease or ulcerative colitis, which are these like gnarly illnesses that really require significant medical and also holistic treatment at the same time, because I'm all about integrating. I'm not all about separating. I'm all about doing it all together. And then irritable bowel, that requires a lot of different things, like whether it be fiber, whether it be food choices, whether it be different probiotics and things like that. So you just want to make sure that you are talking about that. The last two causes I want to talk about: toddlers' diarrhea. This is like literally kids that, like, you might not even realize it, but maybe they're getting too much like juice, like fruit juice, or they're getting too much, like, I don't know, maybe it's summer and they're eating like a boatload of popsicles, or they're eating, I don't know, watermelon or something like that. It's usually from that, and they're just not absorbing that well because like the sugars and the carbohydrates kind of make their tummies funky, and then they can get diarrhea. So you would just, if you're seeing that, like obviously just cut back on all that stuff and like go to a more balanced diet that has like all the different food groups and everything like that. Traveler's diarrhea, that kind of goes back to the bacteria, viruses, and parasites, but that's the last one I wanted to mention. Like if you are traveling to another country, especially if it's a country that still is working on their sanitation and all of that, and you've been in maybe some kind of sketchier food situations, like definitely bring that up, because there could be something a little bit different than we would think about, like in the US, going on with bacteria and parasites and stuff that your doctor is going to want to check out. Okay. So when is like a huge red flag? I would say one, blood in the poop. So, by the way, you guys, blood in the poop does not have to mean cancer, but we want to figure out what it's from. Okay. So we need to make sure, like, is it a hemorrhoid? Is it something super simple like that we need to treat constipation? Which, if you need to know more about constipation, go see the other episode that I totally did on that. Is it a tear, like a fissure, like a little cut in the booty? Because that can cause it. Or is it something more sinister? Like, is it, inflammatory bowel, like ulcerative colitis or anything like that? So we need to find out. So if you're seeing blood in the poop, bring it up to someone. We just need to check and figure out what's going on. High fevers, that's also another sign that it could be something more than just like a viral stomach situation. It still could be that, but you just need someone to make sure there's nothing else going on. And then dehydration. So in babies, if you're seeing less than 2 soaked diapers in 24 hours, like good soaked diapers, or in any age group, if your kid is super lethargic to where they can't wake up to feed, they can't wake up to play with you or interact with you, or they're looking like the inside of their cheeks are super dry. Usually lips will look a little dry, but I'm talking about like the mucous membranes on the inside of the mouth. If that's looking really dry, they're really tired, all of that, they're not urinating well, that can be a sign of dehydration. So you definitely want to go in and seek care, because that's the main problem with diarrhea, you guys, is that kids will get dehydrated quickly, especially babies. So we just don't want to wait. If you're seeing any of that, you'll want to seek urgent care or ER care, or get in with your, pediatrician right away. And then sudden weight loss. So if your kid is like, oh my goodness, like, they were 100 pounds and now they're 80 pounds, something's going on. And I'll give an example of this. There's a kiddo in my practice right now that I think he's back up to weight 104, but he had dropped down quite significantly. Don't quote me on this, but I think it was like 88 or 85 pounds. He was pretty low. And, we have to make sure he doesn't have inflammatory bowel disease. He also has like H. pylori that I tested for. So there's all these things that it can be, and you do want to just make sure what is going on with that. But the main concern, if it's super sudden, it would be dehydration. And dehydration is, that's kind of a scary thing. And so we do want to treat that with fluids, whether it's oral or whether it's IV. And that sort of depends on the situation. And I wouldn't make the call at home. If you're feeling like your baby's getting dehydrated, if you're feeling like your kiddo's dehydrated, just go and get care, because you want like a trained professional to tell you, like, is this something you can treat safely at home, or do you maybe need IV fluids? Okay. All right. Let's say you've gone in and, your pediatrician's like, cool, I think you can manage this at home. Or you're thinking, okay, we've all had a little like tummy bug for a couple of days, but doesn't seem like that bad. We're urinating fine. My baby's drinking well. There's no fever. There's no red flags. What can you do? Okay, so for babies, you're going to be doing breast milk or formula for hydration. So you just want to keep feeding them. Make sure that they're maybe feeding a little more frequently at the breast or the bottle. Keep giving them more. Around 6 months old, you can start doing a little bit of oral rehydration fluid. But, after a big blowout or something, you might want to do an ounce or two. But the majority of the nutrition needs to still come from the breast milk or formula. Okay. So we're not trying to like replace it with like, I don't know, like Pedialyte or something like that. Okay. You really want to just keep with the formula and the breast milk, and monitor their diapers. So in infants, 0 to around 12 months, if you're seeing less than 2 soaked diapers in 24 hours, or if your baby is so lethargic that they won't wake up to feed, they look really sick to you, they have a fever, 100.4 or higher, anything's going on that they just don't look right to you, you want to take them in right away. Okay. Older kiddos, that's when you can do a little bit more with like the oral rehydration fluids. And there are some cleaner ones on the market now that have like the salt and the sugar and all of that. And yes, there is a little sugar in it, and there's reasons for that. But you do want to avoid all those ones that have like the food dyes. Like, you're not going to want to do like Gatorade and Powerade and things like that. And I can even link, if I think about it later, I'll link a recipe for like homemade electrolyte solution. A lot of people will do it, but some people understandably don't have the bandwidth for that, because your baby's sick and it's diarrhea. You're already dealing with that. And then trying to make this rehydration fluid as well can be like overwhelming. But the main thing is, in older kids, like 12 months and up, well, really any kid, you don't want to be giving them a bunch of sugary drinks. So like fruit juices, Sprite. I remember that was huge back in the day. Like everyone was like, oh, your tummy hurts, like do Sprite or 7-Up or something. Like stay away from all of that, because that actually will make the diarrhea worse, because it has a lot of sugar. So fruit juice, sodas, what else? I'm trying to think. I cite this already, I think, like the Powerade, the Gatorades, all of those. Stay away from those, because it's not going to help. And, in kids that are eating already, you do want to do like bland foods. I usually recommend the cram diet. Used to be like the brat diet, but now I kind of do more of the cram diet. And so what that is cereal, rice, apple or applesauce, and then milk substitutes. So this is for kiddos like a year and up usually. And it would be like cereals that don't have sugar. So like, something super bland, like an oatmeal, something like that. And then rice cereals. again, super bland. Applesauce, because it helps with the pectin. It helps kind of bind the poop up. And then milk substitute. The reason I say that rather than like a cow milk is because sometimes the cow milk will actually cause diarrhea when your kid has diarrhea. So it seems kind of backwards, but basically what happens is your kid gets diarrhea from whatever reason it may be. And then because they're sick, they develop like a temporary lactose intolerance to whatever milk. So mammal milks, cow milk, goat milk, camel milk, whatever milk, okay, that's from a mammal. Just avoid that just while they're sick. You can go back once they, are feeling better, but doing it while they're sick, that can cause a little bit of diarrhea too. So you could do like a milk substitute, like oat milk, hemp milk, almond milk, any of those, assuming your kid doesn't have like a food intolerance or something like that. What else? Okay, so gut microbiome stuff. You definitely want to come in for that because you're going to need to chat with, your integrative doctor about, does your kid need just like a probiotic? Like, do they have like yeast overgrowth and they need Sac boulardii? Do they just need like a general probiotic that has like lactobacillus in it? Or is it something that, is really out of whack and we need to do like a GI map test, which is a test to look at all the different germs in the gut. So looking at the healthy bacteria, the bad bacteria, the digestive enzymes, if they're sensitive to gluten, like it's a test that tests all of that. And some kids really do need that to kind of get to the root cause of what's going on. Food intolerances, again, that can be a thing too. So you'll want to come in and talk to your integrated pediatrician about that, because it's possible there could be some kind of either a more severe medical condition like celiac, like I have, or it could just be more of a sensitivity. Like maybe if they drink too much milk, they just get a little funky with their gut, that kind of thing. SIBO, this is small intestine bacterial overgrowth. It's a huge word. It's not as common. Mostly what I see is the other things, like just kind of a general gut microbiome imbalance in kids, but some kids do get this. If I do see it, it's usually more in the teenagers, especially if they've taken like a lot of antibiotics and things. But again, if diarrhea is going on and on and on and it's not resolving after a week or two and it's not getting better during that time, come in, because there can be a lot more causes than just the viruses and bacteria and things like that. I shouldn't say just, because we still want to figure out what's going on with those. Other things that we can do, obviously, the GI map might be something we would do. Parasite testing might be something we would do. Depending on what's going on, we might want to just see how the detox pathways are working, because everything's connected. So if we're not detoxing well, that can be a problem. It's not necessarily like exactly to do with the diarrhea, but it's just, I guess what I want to say is like, basically your body detoxes 3 ways: sweat, urine, and poop. And so in order to detox well, you need your poop and your digestion working well. And so it's kind of all related. And then the organic acids help us look at your liver, which helps us determine like if you are detoxing well. So it's kind of like connected in a backwards way, but it's definitely something you want to look at. Okay, what can you guys do herbally at home? For the little kids, like 6 months and up, you could do chamomile. So that's really soothing for the tummy. You could try either just brewing some chamomile tea and doing 1 or 2 mLs of that at a time, or you could do the homeopathic by Boiron, which we can link to my full script so you can get the discount if you want that. And that's a homeopathic that's really safe for babies. And you can give, a little bit of that to kind of calm the tummy down too. You can also use the Boiron tummy, which is another homeopathic, and has a few other things if their tummy's really upset. And then, older kiddos, you can also add in like slippery elm, which is really soothing. It kind of like lines and coats the esophagus, and it coats the digestive tract and the mucous membranes. So you can try that. And then marshmallow. I'm not talking about, when I say marshmallow, you guys, I didn't really realize this when I started learning about herbs and stuff, like way back when. But we're not talking about like buying the marshmallow that you roast on the campfire. This is like an actual herb that you can buy and you can get from the health food store. So don't confuse those, because if you do a boatload of marshmallows when your kid is sick, it's not going to go well. So definitely the marshmallow herb. And again, it's just soothing and coating, and it coats the throat and the esophagus and the mucous membranes, the stomach, all of that. So I think chamomile, slippery elm, marshmallow are always good to do. And then antibiotic associated diarrhea. We might want to do like Sac boulardii, which is a probiotic. In some kids, I'll do lactobacillus. The evidence on the probiotics is still a little bit mixed, but I just tend to find that it seems to help. So I'm still using it, and I do think it helps balance the microbiome in general. Okay. So we sort of talked about this along the way, but just as a reminder, if you are seeing red flags, so dehydration, high fevers, blood in the stool, your kid is lethargic to where they can't wake up to play or interact with you, their mucous membranes are dry, like their mouth is dry on the inside, anything like that, or if your kid just looks super sick to you, you do want to go in to see the pediatrician and the integrative provider. I mean, ideally, I would say see your integrative pediatrician because I'm a little bit biased, but see someone because that's more of an urgent situation where your kiddo might actually need IV fluids. Now, if it's like, okay, your kid is still drinking and they're having like good wet diapers and you're not seeing the blood and all of that, then try doing some of those home remedies with like the oral rehydration that we talked about, plus or minus like the probiotics and the herbs, like the marshmallow and the slippery elm and the chamomile and all of that. And then I would schedule an appointment just to follow up with your pediatrician maybe the next day or a day after and kind of go from there. Okay, so we did it. This is a quick one, but I think it was a goodie. This is the third part of my mini series on poop. So we've done normal poop, we have done constipation, and now we have done the poop that won't stop, diarrhea. And next time I'm going to do gut microbiome. So that should be like a really interesting one. And I'll just link all of those here, especially the other one when it's done. For all of y'all that don't know, I have a course coming out I'm very excited about. It's all about how to feed your baby in the first year of life from age 0, or I guess day 1, age day 1 until 1 year old. And basically how to feed your baby from 0 to 1 year so that their microbiome is healthy, so that hopefully they don't end up with things like, diarrhea from the microbiome being off, or other illnesses like allergies, immune system problems, brain inflammation, like all of the things. So super important and educational material. And I just want you guys to have it. So when that's ready, I will link that too. Okay. Wishing you well. Bye.